Thank you for the invitation to present to the board today. I am hoping to give you some suggestions and guidance and goals that might be reasonable for the Howard County Public School System to pursue to help make this learning environment safe for all of us, despite the Omicron surge that is challenging us severely. So I will share my screen now. And if somebody could verbally confirm that it is being shared.
We can see you.
Okay, thank you. So I am an assistant professor at the University of Maryland School of Medicine with a PhD in the epidemiology of infectious diseases. I do not, however, speak for the University of Maryland School of Medicine. I do, however, speak for myself from my expertise and as a parent with a child in the Howard County school system. My oldest son is a third grader at Phelps Luck. So this is, in fact, also a deeply personal problem for me. So the first thing it is important to acknowledge here is the COVID incidence in Howard County has in fact skyrocketed. This should not be news to any of you at this point, but I think it is important to see and know what the numbers are, because I'm an epidemiologist and we're going to be talking about the numbers for some of these future slides. So here we have the entirety of the epidemic. This comes straight from the Maryland State Department of Health website. And we can see here these are the cases rate. This is the case rate per 100,000. So it's the 7-day average for the number of new COVID cases that are reported on one given day. So it's averaged across 7 days, but meant to represent one day. And so here we see the latest report from yesterday, published this morning, which is Howard County at 167.38 per 100,000. And we're not quite at the peak where we were just a little bit ago, but we are substantially higher than any previous surge. Now you may look at this and say, okay, that's fine, but the news tells me that Omicron is mild, and what do I have to be worried about? So unfortunately, although the individual level severity is reduced, and that is good news, that's good news for that's news for optimism. That doesn't even make sense. Anyway, it's optimistic news. But when you have more than 4 times the cases, a drop in severity to 1/4 the previous risk is still something that challenges our hospitals and overwhelms our healthcare system. So when you've multiplied your individual level risk of infection, your risk of acquiring an infection from all the sources around you by more than 4, your chances of having severe disease end up being higher than if you had a less infectious variant that was more severe. This is compounded by the fact, as I'm sure you're all aware, that monoclonal antibodies are in short supply. And so for people who are high risk, they're often facing really dire situations in which the supply is being rationed until people are more sick. So we're in a situation right now where our healthcare is at capacity and we don't have the treatments we need. So what this is to say is that I'm not here to say that schools are driving this transmission, right? I'm not here to tell you that schools are the only factor that's causing these hospitalizations to go up, but it's just recognizing the challenges that students and families are facing as they consider what their risks are of in-person learning versus other types of environments that they might be in. And I want to note here again that because schools are not the only driver of all the COVID in the community, then there is an opportunity here to make schools safer by prioritizing schools over other activities, right? So prioritization does not mean keep schools open at any cost, no matter what the risk, or keep schools open even if we functionally can't. It means taking other steps out in the community to do things that can reduce these transmission rates so that schools are safer just by virtue of the community being safer. So if anybody on here anybody listening to this has any sort of influence, has any sort of decision-making power, please think about ways that we can promote more distancing. We can promote more control out in the community with the goal of truly prioritizing in-person education, putting it at the top of our list where schools can stay open even if other things cannot proceed as normal. I know, however, that that's not a thing that the board or the superintendent or the teachers have any control over. So that will be the end of that part for this conversation. One of the reasons we find ourselves in this situation is that vaccine efficacy against Omicron is substantially lower than the efficacy observed against previous variants. So it is still worthwhile to get vaccinated. What we have here in these figures is we're showing on a scale of 0 to 100% protection, the protection given by the primary series, which would be 2 doses, right, is what we usually say, by the primary series against symptoms of slightly more than 30%, or against hospitalizations of about 70%. And if you get boosted, then vaccine efficacy against the hospital, if you get boosted, your vaccine efficacy against symptoms rises to about 85% and almost 90% against hospitalization. So clearly major benefits from getting vaccinated, and it's absolutely a bulwark of our public health program. Unfortunately, it's not enough, and it is no longer sufficient to assume that a vaccinated person is necessarily uninfected. Against previous variants, that was a totally legitimate way to look at vaccines. We had greater than 95% efficacy against symptoms and against infection when we went looking for it. That protection was really high, and you could safely assume that a person who is vaccinated was unlikely to be carrying COVID. And that's just not the world we live in anymore, unfortunately. So what does this mean? What do these numbers mean for COVID in our schools? What does it mean for what our schools and our classrooms are experiencing in real life? So I used the 167 cases per 100K, and I put it into a calculator that I developed actually last year, pretty close to the beginning of the pandemic, asking for a given case rate, what does that mean for how many COVID cases will arrive in your school? And I am extremely focused on my own child's school. And so I put it into a school with 694 students, which is the 2021 to 2022 enrollment for Phelps Luck. And I put in 60 teachers, so 60 adults and other staff who are in the school with those students, and asking how many infections would we expect in that school community of 694 students plus 60 adults. And what we see is that on average, we are expecting about 40 cases, with maybe about 4 of those 40 among students. So sorry, I explained this better. So here, this bar in blue is the number of children that we expect to arrive at school with COVID. And the orange is the number of adults that we expect to arrive at school with COVID. And here we see that when we have these symptomatic cases, we are expecting about 36, that if you exclude symptomatic cases, so if you exclude the people who are very obviously experiencing a COVID-like illness, that would probably exclude about 4 of them on a given day. And so you would end up with 40 cases arrive out of your 40 cases that do exist in your school community, 36 who would arrive at school if you only did symptom-based screening. If you do testing programs, if you make testing programs available, you can cut this number substantially. You can detect the infections early in their pre-symptomatic period, which we know is highly infectious. So you can detect them before their infections, so you can detect them before they manifest, but while they're still able to spread. We also see that on average, in that same school community, you would be expecting about 175 cases, of whom 155 would have made their way into the school community for at least some fraction of that time. And again, some symptom screening and some family-initiated testing in response to contact tracing and exposure and quarantine is cutting these numbers down. I don't think we have a very good sense of what fraction of all cases are being detected by contact tracing right now, either contact tracing that is unfortunately paused at the Howard County school system level, or by other contact tracing that the health department is conducting for COVID exposures that occur out in the community. So this is the expectation without that tracing program. The number is probably lower, but what I want to emphasize is that the risk that the arrival rate is really substantial. And you know that already, right? But this is helping put some numbers on that. Single classroom experience is also useful to zoom in on. So again, taking the perspective of a single classroom with 25 students and one teacher on any given day, what is the probability that one or more than one infection will be in that classroom on any given day, right? So this is taking into account that that just because you're expecting, for instance, an average of so many, that there's some probability that disperses students as whole units across the school in different numbers. If that makes sense, right? Like anyway, you can ask me about that later. So what we see here is, even if you were to exclude symptomatic cases, if you were to assume that our symptom screening is a really viable program, there's a 36% chance that that classroom will have one infected student that day. And there's a 39% chance that it would have two or more infected students on that day, unless they were being removed through contact tracing, through routine testing, or through some other intervention. And so the reason I bring this up so stark is not just to make you all depressed about the state of COVID, but also to make you aware that many families who are risk averse are looking at these numbers, are thinking about these kinds of probabilities, and making the very rational decision that without contact tracing and surveillance testing in place as supported by the school environment is not safe for their student. And I want to be clear that there are many circumstances which are legitimate for those students and those families to make this decision, including a high-risk family member, not just a high-risk student themselves, but a high-risk family member, being caretakers for a high-risk family member, for families that routinely go visit, for instance, grandparents in nursing homes or are caregivers in other way to high-risk people. There are situations in which perhaps the mother in the family is pregnant. These are all situations with a high level of concern. And particularly in this surge, when we see those probabilities of cases arriving in the classroom, those concerns are well-founded. They are not irrational. They are reasonable decisions for families to make. And the reason I say this is because right now, there are not pathways to support those students whose families are making those decisions, right? There are perhaps some pathways that could be created, and I strongly encourage the school system to create pathways to support students whose families have a high-risk situation. Some options, although I definitely leave it to you to implement operationally which of these among these could be considered, but allow absences. So for instance, allowing absences due to COVID concerns to be excused, allowing credit for makeup work, especially at the high school level, that can be very important for students who are trying to maintain grades. Provide access to quarantine virtual supports. So there are some virtual supports in place to support students who are at home for quarantine, make those accessible to students who are also coming from families who are risk averse. Consider automatic acceptance for applications to the home and hospital program, at least in the temporary. I don't know if this would overwhelm the home and hospital program. My understanding of the home and hospital program is that it's primarily for students who have the health concern themselves. So I don't know if that's appropriate, but these are all options and supports that are along the lines of what you would consider for these students. And the main goal that I leave you with is please do not force families to choose between this high infection risk, where you do not see what the consequences could be for that family, and between school and legal consequences. For instance, allegations of truancy, for instance, no ability to make up work. Please put into place the pathway and support for these students that's necessary. But I'm not just worried about students who come from risk-averse families. There are many families who want in-person instruction, and I think that we need to support a safe environment that ensures that continuation as well. So part of that is setting clear standards for any temporary move to virtual learning. As much as that seems like a contradiction, it's actually saying, remove some of the uncertainty. right? Set up the standards so that kids and families can send their kids to school and make a plan to send their kids to school with the knowledge of when virtual learning might be triggered, right? Obviously, nobody knows what the COVID caseload will be tomorrow in a particular school, but certainly there can at least be some thresholds, and families can begin to prepare if they see their school approaching that threshold, right? So I have a third grader, for instance. I could not just leave that third grader home alone if I didn't have a caregiver set up for them, if the school decided to go virtual at the last minute. But I could certainly make arrangements with a little bit of notice, knowing that the threshold is nearing. It won't help in every case, but it would help more than you think. So please consider some thresholds, and the thresholds are not to move virtual forever. The idea of doing a temporary move to virtual learning, the goal would be to interrupt that outbreak and break up the cluster and prevent future absence and illness, right? So setting, for instance, I proposed a threshold here of 25 cases in the school or 5% of the school community testing positive within 14 days, which is a pretty standard definition that's been used for outbreaks. 1 week virtual, test everybody before return. 2 weeks, but if people won't get tested or if you can't get tested. Not actually, I say a week because I'm thinking about a school week being 5 days, but 5 days and 10 days is actually what I wrote here. So won't this be every school might be a question, but the answer is no. I think what we've seen here is that there's high heterogeneity at the schools, meaning some schools will be hit very hard, very fast, and some schools will be spared until suddenly it might be their turn, right? We see that COVID moves in clusters because it doesn't drop from the air. It moves from people who are in contact with each other in schools and in communities. And so the goal of these temporary circuit breakers is to cut the outbreaks off, find the infections, ramp up mitigation in the short term, and also, again, set really clear thresholds for doing that so that everybody can see it coming for what it's worth with at least a little bit of preparation. Another feature which Colleen Morris touched on in the introduction is to use better masks. So this paper is actually only 2 days old, published in PNAS, but the Proceedings of the National Academy of Sciences. And I think there had been a lot of question around whether a poorly fitting N95 type mask was really any better than a surgical mask. And this paper pretty conclusively determined that it is, right? That using a higher quality mask, even if it's not fit as well, is in fact superior to just using surgical masks. This figure is a little bit confusing. Basically, they split the face in half, weirdly, between the infected person and the susceptible person, right? So a contact between two people for 20 minutes. And what is the probability of infection in a 20-minute close contact situation? So if two people are wearing surgical masks, it's 10.4. And if they're both wearing even this FFP2 is an N95 type mask. It's the UK terminology for the N95 type mask. Without adjustment is the red bar. So you can cut your risk in half, even if you have a not well adjusted, not fit tested N95 type mask on. And if you were to have an interaction between two people, one of whom had perhaps a well-fitting N95 mask, so that would be here, these two values here, a well-fitting versus perhaps a student with a smaller face who can't keep a well-fitting mask necessarily, you still have a much lower risk, on the order of 1/10 your risk with two surgical masks. So this is not even a thing that requires a lot of schedule adjustments. This is higher quality masks is a supply issue, and I don't want to minimize the investment in terms of cost or in terms of the logistics and the operations for procuring them. But I do want to say this is replacing your mask type is one of the less disruptive things that we can do to minimize COVID spread in our schools. I also will notice the reason I frame it as an investment is that I know that these masks are not inexpensive, especially if somebody is trying to buy them for their students to wear all day long. And by someone, I mean parents who might be trying to buy them for a student to wear for the entire month that they're in school. It's not an insubstantial cost, and I would hope that the school could find ways to support these better masks. So it's not just the wealthier students whose parents, like me, can afford to buy the best possible mask out there who come to school with one of these well-fitting masks. I want to emphasize the need to protect recovery time from COVID. I know that this is already Howard County policy, but I unfortunately hear from people when the policy fails them and when the rubber meets the road and people are not getting the recovery time that they need. So the CDC guidance states that a 5-day isolation period is sufficient if one's symptoms are resolving. But if symptoms continue to linger at that 5-day mark, it is first of all important to isolate because that patient needs rest, right? We know that COVID can hit some people hard, that it hits people with different degrees of severity. Even the mild cases, what we define as a mild case, is still the kind of thing that can take your breath away, literally. That patient needs to rest, they need medical care and treatment, and there should be really clear communication that there should be no pressure for anyone to return to work or return to school if their symptoms are lingering. Also, the continued presence of a cough and nasal congestion and all of those other upper respiratory symptoms likely indicates more infectiousness than less. And so it's also important that those people continue to isolate to protect the community. So it's true that many people may be recovered or may have been experiencing asymptomatic illness for the duration of the 5 days, but there's also a really substantial fraction of people who continue to need a longer recovery period without pressure to return, particularly for their own health, but also for the good of the community. And again, I think that this is probably already policy, but it needs to be really clearly communicated to every level of supervision, both for students and staff. I'm going to bring up something that Colleen Morris also brought up, and I really want to reinforce this. The CDC guidance that requires constant masking, the CDC guidance for a return to in-person education for those who otherwise would have been obligated to quarantine, so for exposed contacts, does require continued masking on the part of the exposed person. And the K-12 guidance on the CDC website very clearly says to have a plan for adequate distancing, right? So unless we know through testing or other measures that that person has resolved their infection, we need to treat them with a very high degree of caution. We need to treat that situation with a very high degree of caution, right? That they represent a higher than average risk of infection to the people around them. And in circumstances where masks need to be removed, for instance, breakfast or lunch in particular, but also in if they'll be removing their mask to play instruments, if they'll be, you can fill in the blank for all of those instances, but there needs to be a plan for those individuals to distance. I think for the example I gave about instruments, there are probably workarounds where for that period, people would not necessarily practice their instrument in a school setting, but obviously lunches and breakfasts are harder to get around. The point is that urgently there need to be safe distanced spaces for those students where they can take their mask off and where they're not going to be in close contact with anyone else, right? They should not be in the cafeteria with the other students, just mingling at the tables. There needs to be a plan. If you cannot put in place this plan, I strongly suggest that these students either not attend school during the 10 days following exposure or during the 10 days, the second 5 days of what would have been their 10-day isolation period, right? The second half of that. That is obviously not ideal. I instead urge you to set up these distanced options ASAP, because the alternative, the safe alternative, is for them not to be in the school building where they can take their mask off. So I'm going to talk now a little bit about testing. So the gold standard for testing, as I'm sure you're all familiar, would be a quick turnaround for symptomatic case ID, right? So somebody shows up with a case and you find out fast whether they're infectious. A rapid test on day 5 for those cases before they return to school. Routine asymptomatic surveillance and test to stay for people who have been identified as contacts. Now, going from where we are now to that gold standard is a big ask, but I think that there are some things that you can do in order of priority that can begin to chip away at the risk to students in these in-school learning environments. And so what to prioritize now? First, consider whether you can give a rapid test on day 5 for cases before they return from isolation. Again, and if they're symptom-free, right? The second would be a rapid test on day 5 for contacts. And this is none of this is easy, but this is the first step on a segue to a test to stay program, which would ask for at least 2 tests in the 7-day period as capacity increases. Again, that would be the gold standard, would be that test to stay program. And then at minimum now, testing availability for anyone in the school community upon request. I really applaud the steps that have been taken to ensure that staff have access to testing. I think that's so important. Unfortunately, it can still be really challenging for students to find testing. So I have recently experienced this with my own family. It can be extremely challenging, and there is a 5-day turnaround on test results. So decreasing that time frame would be really critical. By the end of those 5 days, that infection has already moved on 2 generations, right? That's not an acceptable testing turnaround. And I'm going to use this word prioritization again, right? So we talked about how to prioritize education above other things in the community, above, hopefully, again, if any of you are listening with any influence, above other activities that are not related to education. But we talk about that with school. We should talk about that prioritization here and now as well. Right now, while there is no contact tracing and while we are in this surge, the extracurriculars need to have more support if they're going to continue, or more restrictions if they're going to continue. At least one of these things needs to be in place for any of the extracurriculars that will be happening. A weekly test to play, constant distancing, or an outdoor environment for those activities. Ideally, several of those layers. And this needs to be in place regardless of vaccination status. It is not sufficient for us just to test unvaccinated athletes or unvaccinated members of the robotics team or unvaccinated members of the choir. Everyone needs it, because as we've seen, vaccine is not full protection against carrying that infection and giving it to somebody else. And if this is not possible, then I think a temporary suspension of extracurriculars is warranted. And the second part is also really important. Require the same for all activities that are using school venues. So a lot of the Howard County decisions that are made by the school system set the tone for the community, right? So the community will, for instance, have an activity if the Howard County schools are having a similar activity, or they'll cancel it if not. So when the school venue is being used, use your leverage, use your influence to put in place those breaks, because it's those same kids who are showing up to school the next day, right? It is those same kids who are going to be participating in the after-school activities in the gym, who then come to 4th grade the next day, right? The goal here, particularly right now, is to prevent outbreaks from spiraling, particularly while we are in the dark about contact tracing, right? Right now, we are in a particularly vulnerable period where outbreaks could begin to spiral out of control without us watching them. So a temporary suspension until contact tracing comes back online is definitely warranted. And so the final thought I leave you with is this too shall pass. I hope that by early March, we are not talking about any of this anymore. There's a lot of optimism that we might be at the peak of this, and that our goal is just to get through this with our students and our families as healthy as possible. However, if you'll notice, I didn't say next week. So this is still something that needs to be managed right now. And unfortunately, it is my opinion as an infectious disease epidemiologist who's been working on COVID for 2 years now, that there will be future waves, and it is wise to prepare for them. Don't treat this one like the last one. So on that cheerful note, I'll take any questions or pass it back to Colleen Morris. Colleen, I leave it to you as to what's appropriate.